Hello, my name is Ruben B. Boer. I'm a PhD student in developmental psychology at Liberty University. In this presentation, I will be discussing neurocognitive correlates of pediatric epilepsy, a quantitative analysis of executive function and seizure-related factors among children aged 0 to 17 in Minnesota. The purpose of this study is to examine whether seizure frequency and seizure severity predate impairment in executive functioning in children aged 0 to 17 living in Minnesota. The variables studied in this study include A. Seizure frequency is physiological variable operationally defined by PROSI using empirical embrace a wristwatch device. Function executive function measured use scores from the behavioral rating inventory of executive function BRIEF2 and seizure severity measure using the National Hospital Seizure Severity Scale NHS3. By examining seizure-related factors in executive function EF in children aged 0 to 17 in Minnesota, this study seeks to advance a dimensional developmental information framework for understanding cognitive risk in pediatric epilepsy. This study is based on 4 premises. 1. Epilepsy is associated with deficits in executive function. Systematic review of executive function EF literature showed that children with epilepsy frequently exhibit executive dysfunction despite self-limited seizures. Lopez Santo et al. 2023 and Kura et al. 2024 demonstrated that children with posterior cortex, frontal, and temporal lobe epilepsies show marked deficits in working memory, processing speed, and other EF domains compared with controls and across syndromes. Hickard et al. 2023 and Krause et al. 2023 reported executive dysfunction is common in pediatric and adolescents and is linked more to altered What Matters organization. 2. Hickard higher seizure frequency associated with worse cognitive and executive outcomes. Individuals with ongoing seizure perform poorly on memory and show broader cognitive difficulties than those in remission, indicating that persistent seizure activities worsen cognitive outcomes. Review of children onset of epilepsy similarly highlight poor seizure control and recurrent episodes as significant risk factors for neuropsychological deficits. This reinforces the idea that higher seizure frequency is associated with more severe cognitive and executive function difficulties. 3. Seizure severity is inversely related to cognitive outcomes. Severity indexes that go beyond simple frequency, such as drug resistance or multiple seizure types, also worsen cognition. Aki et al. 2023 showed that greater extension of microbial activation in patients with refractory seizures is associated with lower developmental and cognitive scores. Sinuglu and Odesman 2023 reported that children with epilepsy show reduced EF alongside poorer functional mobility, indicating that more clinically complex presentations coincide with broader neurofunctional impairments. 4. The impact of seizure on cognitive functioning is more pronounced in children with epilepsy than in adults. Avian 2022 argued that seizures occurring during childhood hinted of ongoing brain maturation, increasing the risk of persistent cognitive and EF difficulties. Empirical pediatric studies show that cognitive and executive function emerge early and affect school achievement and behavior. This developmental vulnerability suggests that comparable seizure burdens have more disruptive, long-lasting neurocognitive consequences when epilepsy begins in childhood than when it first appears in adulthood. Research design and hypothesis. Research design. The current research will utilize a correlational research design to examine the relationship among seizure frequency, seizure severity, and executive function among children aged 0 to 17 with epilepsy living in Minnesota. Research hypothesis. It is predicted that among children between the ages of 0 and 17 years diagnosed with epilepsy living in Minnesota, there will be a negative correlation between seizure frequency and BRIEF-2 scores, as well as between scores on the NHS-3 and score on the BRIEF-2. Methods. Participant. A sample set of 138 derived from a GeoPower a priori correlational analysis will be used. Participants aged 0 to 17 with confirmed epilepsy living in Minnesota will be recruited through pediatric neurology clinics, epilepsy centers, and Minnesota hospital systems. The gender, ethnicity, level of education, or socioeconomic status will not be the basis for exclusion. Participants who complete the study will receive a $10 Target gift card. Apparatus, materials, and procedures. The empathical impress Epi-monitor, a risk-1 device for epilepsy, will be used. This device continuously records physiological signals. It uses algorithms to detect possible generalized convulsive seizures, and it sends alert to caregiver via a paired smartphone. The NHS-3 is a clinically validated semi-structured tool used to quantify seizure severity based on functional impact, physical consequences, and post-seizure recovery. It provides objective, standardized, and reproducible clinical data. It captures seizure characteristics across different seizure types, for example, types 1, 2, and 3. It will be administered during clinic visits. The BRIEF-2 has 3 standard written forms selected depending on age and caregivers. Parent form ages 5 to 18, teacher form ages 5 to 18, self-report form ages 11 to 18. For children younger than 5 years old, clinicians will use BRIEF-P, that is the preschool form. T scores greater than or equal to 60 indicates impairment, while T scores greater than or equal to 60 reflect clinically significant executive dysfunction. Procedure. This study will follow institutional approvals and data use agreements. Participants will be pre-screened and eligible family will be informed. Written parental consent and child assent will be obtained. All personal data will be de-identified to ensure HIPAA compliance. The Epi-monitor will be used to detect possible convulsive seizures and alert designated caregivers so they can provide timely assistance. Participants will wear the device on the wrist, usually on the non-dominant one. Caregivers or adolescents will use a brief tool publishers Q Global or Q Interactive system, either in person or remotely. Participants will rate 63 items on a 3-point Likert scale, that is never, sometimes, or often. Thank you for listening to my presentation. These are my references. Thank you.